Welcome to the seventh segment of our Health Equity Basics Learning Series. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. This segment reviews some of the actions individuals and organizations might take to help advance health equity. Everyone has a role to play in advancing health equity. There is work to be done at all levels. Even small changes can contribute to advancing health equity. Each one of us can join the effort to advance health equity as a community member or a member of an organization. First, understand people's rights and no laws against discrimination exist. Second, we can work to become aware of our biases and notice when we contribute to microaggressive behaviors or when those behaviors happen around us. We can practice the humble model of cultural humility to support that work. We should be aware of and support culturally and linguistically appropriate services where we work and in our community and help support organizations currently working on health equity. Lastly, we can engage in lifelong learning and help create a safe space for discussions about culture, bias, diversity, and inclusion in our lives and in our workplace. Organizations can work collectively to advance health equity. We can work to recognize, respect, and support diversity in the communities we serve. We can use clear and culturally relevant information that is suitable for diverse audiences, train all our employees to identify and interrupt all forms of discrimination, and provide them with training in implicit bias. We can deliver services in a culturally appropriate way, build partnerships with different sectors and community members, look to develop upstream solutions, and collaborate to advance health equity. A link to the full list of actions for organizations can be found in the video description of this segment. As healthcare organizations and leaders, we can establish a commitment to health equity and adopt an upstream approach. We can create cultural and equitable patient education materials and develop partnerships in our communities to help implement health-related social needs screenings. Be aware that quality improvement efforts can unknowingly improve care for one group of patients while worsening it for another. It is important to keep health equity considerations in mind when planning and executing quality improvement projects. We can use data sources to help identify gaps in care and opportunities to advance health equity. Health equity is a complex topic and communicating about it can be challenging. To create a broader understanding of the social, structural, and systemic factors that may impact health outcomes and help move our efforts upstream, we must meet our audiences where they are. We need to learn their beliefs, values, and biases toward health equity topics, communicate health equity as a WEEP issue, and build on shared values. We can also frame health equity as an achievable goal and provide examples of how each level of the organization can help advance health equity. Advancing health equity requires us to work together to remove barriers so everyone has the chance to live the healthiest life possible. In the final segment of this learning series, we will provide information about the resources used to produce this program, as well as some additional resources on the topics we have covered across all the segments. Thank you for joining us.